I wanted to thank everybody for being here, and earlier I said that if you're sitting here today, I believe you have a degree of insight that maybe others may not have, or they think this is not that important, alternative medicine, New Age community. But the thing is, this is a topic, an area that's going to permeate every aspect of society globally, and it's not going to go away. And if you are a healthcare practitioner of any kind, this is something that address and learn about. But before we start, if you don't mind, I'd like to pray for our time together. Heavenly Father, I want to thank you for this time together for us to discuss this so very important area. And we pray that as practitioners, you give us sobriety and wisdom in this area of alternative medicine and the New Age community. And also, we just ask for this time that we are together, may the words of our mouths and the meditations of our hearts be acceptable in your sight, O Lord, our God and our Redeemer and our Rock. In Jesus' name we pray. Amen. Once again, I wanted to thank you for being here, and you may have heard this story. A man dies, goes to heaven, and he's standing at the pearly gates. And he's standing before St. Peter, and St. Peter says, "So why should I let you in?" And this man says, "Well, you know, I'm a Christian. I accepted the Lord. I'm covered by the blood of the Lamb. Plus, I'm an engineer, a civil engineer. I built a lot of neat things. I think I should get in." And St. Peter said, "Sure, sir, go right on in." And the next man comes up, and he says, "I want to go to heaven." St. Peter's at the pearly gates and says, "Why should I let you in?" This man says, "Well, first of all, I am the CEO of a managed care company. And I believe I deserve to go to heaven because I have created employment for many people, jobs that didn't exist before. I have provided quality health care to people who normally can't afford it. And I have even helped physicians and nurses and other healthcare practitioners make medical decisions for their patients, all while saving money and making money. And I made a handsome salary my whole life. I had a great, supported my family great, and I even donated money to a church named St. Peter's just the day before I died. So I know I should get in." So St. Peter looks at him and says, "Wow, you sure have a great resume, but I'm not quite sure this time, so I need to check with God." So he goes away, he checks with God, he comes back and tells this man, and says, "Sir, congratulations, welcome to heaven." So he's walking through heaven's gate. And then, "Oh, by the way, sir," the man turns around, you can only stay for 3 days. Yes, you got that joke. I gave the same joke a couple of weeks ago at the University of Central Florida. And there was a pre-medical student association asked me to go and lecture on this topic. And half of the crowd didn't get it because they were undergraduate students. They were like, "What?" So this is good. You got it. All right. Now, a reason I bring that up, and my dad is the one who told me this joke, and my father's a medical doctor, my grandfather's a medical doctor, my uncle's a medical doctor, my little brother, who is also a medical doctor, he's a 4th-year resident in family practice. My grandmother's a pharmacist, so I grew up surrounded by people from the allopathic orthodox medical camp. I myself have had allopathic medical training, and so I've always been interested in alternative medicine. In fact, my father was a surgeon for many years in Formosa, Taiwan, and I remember as a child I would see this acupuncture model here of the male anatomy, and I feel like putting a fig leaf right over here, but anyway, I think we're all professionals here, it's not going to be a problem. So I've always asked him, it's like, because he did acupuncture, he's trained in that, but he was primarily an allopathic physician, and he doesn't really go for that actually right now. So he's more in the orthodox camp. And I try to ask him, well, what are these points and dots in the line? And he would say, well, you know, it's this another theory in Chinese medicine, and that's all he would tell me. So I ended up learning all this all by myself, independent research and investigation. So what I'm going to do today is I'm going to present some of the modalities to you. I'm also going to go over some of the leaders in this country in the area of alternative medicine and New Age community, and you're going to find that a lot of these leaders are very highly educated people. They're not the flaky New Age crystal rubbing people holding seances that I think a lot of the general public sees. So, without further ado, I want to mention possibly some of the things that be why alternative medicine is coming on strong. One would be managed care, as we said. There's many complaints in the managed care area about, like, let's say a physician will prescribe a drug, a chemical drug for their patient, and the patient will not be able to fill the prescription because their HMO insurance can't pay for it. Okay? Complaints like that. Another possibility would be lack of calling of physicians. And I'm going to bring a little bit of Sunday school lesson into this. And as you know, if you read Luke, the Gospel of Luke, and like the Gospel of Matthew and Mark and John, right, it's the last one, they're all different because they're written by different people to different audiences. And in Matthew, most scholars will agree, is a wealthy person, Matthew, tax collector, written to a more wealthy audience. Whereas Luke is very obviously a poor person, somebody of not very much monetary means, writing to a poorer audience, kind of identifying with them. Well, Luke is allegedly a physician. And if you look at any old day drawings of even doctors in ancient China, you'll see most of the time they are portrayed in art as maybe having bare feet, ratty clothing, definitely not wealthy. So, traditionally in the old age, physicians have always been considered, it's not something most people wanted to do. It's sort of like being your garbage man, you know? Who wants to call the garbage? Why? Because the human person is, people are sick, they're sort of like human refuse. We don't want to be around sick people because we don't want to get sick too, okay? Now, it's a recent occurrence that being a doctor is considered of upper society or considered a lucrative or respectable profession. And that's one thing to consider. Most of our Orthodox practitioners come from that bent, from that thought. And even nowadays, there's some question as to whether some good-hearted future physicians may be weeded out because of the process by which we select them through standardized testing. And yes?
Jesus, he is the great physician,
right.
master healer, and he went to the people that were afflicted with leprosy.
Mm-hmm.
I mean, he had a compassionate heart.
Right.
He went to wherever.
Right. Okay, the comment, and this is for the tape, comment was Jesus was the great physician, and he did go to people with a compassionate heart. And he didn't charge people or didn't refer them to HMOs to pay for his services. Okay. Yeah, isn't that great? Okay. I'm going to try to, we have a lot of material to go through, so I'm going to try to rush through this, and I'm going to try to do a Q&A and discussion at time, okay? Okay, so economic factors, tons of reasons. It's everywhere, and I had lunch with my wife and daughter. They were kind enough to come here to have lunch with me because I wanted to get ready for this. And but just the other day, we went to Walmart, and we saw $4 versions, and this is my audio visual here, $4 versions of this. Now, this bracelet, my father's youngest sister in Formosa, in Taiwan, bought it for my wife 5 years ago as a gift. And at the time in Taiwan, this was a huge thing. Like, it was really popular, and people would buy these because these little crystals, you wear them, they give you healthy energy and good luck and all that kind of stuff. So she got this for my wife. My wife loaned it, so give her credit for that. And at that time, which was 95, nobody's really heard of this kind of stuff. Just the other day, I was with my daughter at Walmart, of all places. It was founded by a Christian businessman. And they were selling $4 versions of these things, and they called them feng shui bracelets. And who knows what feng shui is? Anybody? Okay. Well, just quickly, feng shui is the art of manipulating furniture in your house or putting up certain talismans to promote healthy, good energy. Okay? Anyway, feng shui bracelets. And then we went to Best Buy Electronic Superstore. I was with my little girl. And there were wood versions of these things. And these things were in the gumball machines. You could put like 2 quarters in them and twist it and it comes out. And he called them Buddha beads. And my little girl's 3 and she sees other kids with them. Buddha beads, I want Buddha beads. 2 quarters. Yeah, Daddy's got 2 quarters. Here you go. But it's everywhere. It's coming in our society. So we're going to see a lot of this. Who plays golf in here? Anybody? No golfers? Anybody play golf? Wow. You guys are doctors and counselors and psychologists and pastors. You don't play golf? Well, I don't play golf either, but this, you may have seen this. This is alternative medicine too. And this is a bracelet that, this one's called a Rama. I'm going to put all these here so you can see it. And it's designed to increase bioenergetic flow so you have a better golf game. There you go, alternative medicine. They have Q-Ray. If you ever fly on any of the airlines, they have a Sky Mall, and they cost like $100-some each. Someplace $120, and they're like super fine precious metals. And then you have the cheap $5 kind, and So anyway, it's everywhere. I don't know if you knew this, but Cigna Healthcare, it's a managed care company, hires professional feng shui specialists to help build their clinics. And out in California now, if you are in the real estate business, or a real estate professional, you almost have to take feng shui classes. If you're an architect in California, you got to take feng shui classes in order to stay competitive. So it's everywhere. Here's the next question is, what is alternative medicine? That's actually kind of hard to explain. I know I promised in the learning objectives you'll know exactly what alternative medicine is. And you will know exactly what a New Age community is. Well, it's all a lie. But to know exactly what it is to know that we won't really know exactly what it is. Got it? So to understand this is a very difficult area to define. And in knowing that you know it, okay? Now, a good definition, and it's on your worksheets, by the way. The last page is a blank sheet for you to take any personal thoughts or notes, questions, comments. You can always get back to me because I know there's so much information. One of the toughest things I had for today was to decide what to present in the little time that we had. And I also wanted to do Q&A. I hope we can get to it. The sound guy said, well, if you do Q&A, you got to repeat the question they say or walk up next to them. So hopefully I didn't eat anything bad, so the breath won't be too bad if I have to walk up to you. Okay, simple definition on your worksheet. It says, basically, a good definition, I think, of alternative medicine, for now, is anything that is not taught in an orthodox allopathic medical school. All right? If you don't learn it in medical school, it's something else. Now, that's a pretty good definition, but the problem is, like, for example, nowadays, my younger brother just graduated from medical school 4 years ago, and he said that around the time he was graduating, they're thinking about putting an acupuncture program in. Why? Because acupuncture, out of all the modalities, and we're going to go into that later, has had the most research data backing it as being legitimate, it works, basically. So a lot of the alternative modalities do not have any medical or scientific data backing it as being effective. And that's another way you can classify it as being alternative medicine. Now, another interesting thing is the last time I checked with the OAM, remember that, hopefully we get to the quiz at the end, stands for the Office of Alternative Medicine in our government. Psychotherapy is a modality of alternative medicine, along with music therapy, acupuncture, chiropractic, yada, 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 you can go on forever. And so, for everybody who is here today, and I'm speaking now to hopefully a bigger audience of people who are going to buy this cassette tape, who are in AACC, or anybody who listens to this tape, if you are a practitioner member of AACC, if you do psychotherapy or counseling or Christian counseling, and Christian counseling would fall under, according to the government, under the category of psychotherapy, you are an alternative medical practitioner. Did you know that? We are categorized, AACC here is categorized as alternative medicine by the OAM. But I thought that was an interesting thing to bring up. Okay, but real quick, most people when you do say alternative medicine, they probably don't think about psychotherapy, they probably don't think about Christian counselors, but and including folks in the Christian community, they probably think about acupuncture, like this doll you see. It's the acupuncture meridian model for the male. And you'll notice that they'll have the same anatomical model for female and also for dogs, cats, and for cows. Because in parts of China, they will use acupuncture on farms. And it works. So anyway, think of acupuncture, Eastern philosophy. Reiki is a new one. How many here has heard of Reiki, just by show of hands? Quite a bit. It's a new one out there, and there's always something new coming up. And one of the things I do is I investigate in virtually everything, no matter how stupid or ridiculously dumb it looks like. My wife calls me a sucker, and I told her, yeah, you're right, I am. But I think there has to be a bit of the suckerness to be open-minded enough to waste your time, well, not waste them, spend the time to look into what it is this person is claiming, okay? for those people who think of it that way, there are, in the evangelical Christian community, there might be some people who might be a little apprehensive about all of this, alternative medicine, New Age, and all of that. And for those, I want to just read the verse, 2 Timothy chapter 1, verse 7, and this is kind of like my version, but it's for God has not given us a spirit of fear, but of power and of love and a sound mind. And in light of this verse, I'd like to bring up Dr. Neil T. Anderson has a book, and it's called The Bondage Breaker. How many people know about that book? Okay. The reason I bring up Dr. Anderson's book is because, well, first of all, in my opinion, if you're a Christian doctor or a Christian psychologist or a Christian practitioner of any kind, you must, in my opinion, you should read out loud those statements about who you are in Christ in the back of that book every single day. Simply because you are a Christian, simply because you're a doctor and a Christian, or a psychologist and a Christian, or a pastor and a Christian. Oh yeah, pastor and a Christian. Anyway, you need to read these things out loud as a good reminder, and it's a good spiritual battle tool. Okay, that's my plug for him. He didn't pay me to say this. I just use this stuff every day. I read it today. I try to do it every day. But the reason I bring up his book is because for those who might have apprehension or fear, he talks about our authority in Christ over Satan and the demons. And the authority word in the Greek that Paul brings up, I think it's Paul, yeah, is military authority. So it's very different. I'm going to use green. Actually, at my experience with the Air Force, I probably should have used blue, but I'll use green to represent the military, and I'll use red for the spiritual authority, okay? Now, with military authority, as I experienced it, and as most people understand it, is a linear type of authority, meaning top, middle, low man on the totem pole, okay? So whatever the person on top says goes for everybody else. So here, let's say this is President of the United States, and of course at this point, I'm ashamed of Florida, we don't know who he is. Okay, this is our military authority. Then you have like heads of states and then generals, officers, okay, high-ranking officers, generals. Then you have other officers, like, different levels, all the way down to second lieutenant, right? Second lieutenant, all right? And then you have big guys. They're called NCOs, E10s, right? They're like sergeants, chief master sergeants, real high-ranking sergeant that have been in the military and have probably worked alongside the generals up there. So they're really high-ranking. And then you have the other NCOs, lower ranking like corporals. And then you've got enlisted men, okay, by rank, E1, E2, E3, E3, okay. Now, here's the deal. If this guy, the president, says you're going to do something, by authority, everybody must obey underneath, okay? Now, in the military illustration, a lot of times what happens is you have a 22, 23, 24-year-old man or woman who becomes a second lieutenant in the military, and they come in right here, okay? Now, coming in here, they are actually an authority over a master sergeant, somebody who may be 50, 60, 50 years old if they haven't retired yet, but they're very smart, very experienced, very, knows a lot about the service. And there have been times when this young officer will be intimidated by the strong, smart sergeant, okay? And can be easily manipulated by the sergeant. I think all of you know where I'm getting at. Now, so I'm not going to go anymore. But the authority is still in the second lieutenant's hand. He or she must establish authority over somebody, even though the sergeant's smart and all. Now, on the spiritual end, we have God. And I'm going to go Abba, Father, Jesus, Son, and HS, Holy Spirit, okay? That's at top. Who's underneath? Any guesses? Who's next in line of command, of authority? Anybody out there? Absolutely. Us, Christians, okay? Then come the different levels of angels, and then you have the lower ones, and all the different, read Billy Graham's book, Angels, he talks all about that. Then you have the big S, Satan. Then underneath Satan are his little d's, demons. okay? As you can see, even like you look at, we're right here. Oops. And then you've got the second lieutenant is way down there. We're pretty close up. And so what Dr. Neil T. Anderson reminds us to do is to remember our authority in Christ over everything, right? So we can approach this topic without fear. Now, that's my Sunday school lesson, and we'll move on. Okay. Now, in light of this Sunday school lesson of those who fear, and I've talked to, and you may have heard of Dr. Walter Larimore. He's a Christian physician. He's a medical doctor and is in family practice in Kissimmee right now. He had his own show, Ask the Family Doctor. But anyway, I had a chance to ask him how he felt, like if there was fear in the Christian community about this topic of alternative medicine. And I want to quote him, and I got permission online from him to quote him. And Dr. Walter Larimore's opinion is, "I'm not real sure that I sense a fear of alternative medicine in the Christian community. Instead, I see more of a blind, non-critical acceptance of anything proposed by an authoritarian Christian figure." His words are great. They're better than mine. I agree with it wholeheartedly, so I thought I'd read his quote. Thank you, Dr. Larimore. Here's the thing. I wanted to present this workshop as an informational workshop, and I will try my best not to rate any of these modalities. We're all practitioners here, and I think you will keep the biblical perspective in mind. So without further ado, I want to present some of the possibility as to why alternative medicine in this country, in America, has been so attractive to the general public. Okay? And here's one way of looking at it. You see, and if you can turn in your worksheets to, I believe, page 4, there's a diagram there. But I'm going to draw it out on the overhead, and so you can look at both. You see, most people in the community, of general population, and this is important because as you meet with your patients or your counselees, this is something to keep in mind. They see Orthodox practitioners as coming from this treatment philosophy, okay? So the Orthodox, I'll just put ortho, right, is you have a body and then a mind and a spirit. So if there's something wrong with the person's body, they have a medical or a physical problem, okay? And if they have a medical or physical problem, they have something wrong with their body. Physically, anatomically, somatically, all right? If there's something wrong with a person's mind, then they have a psychiatric, psychological, or mental problem. Those are the patients and clients that we see, counselees that we see, okay? And if they have a mental problem, then something's wrong with their mind. Do you see how it goes back and forth? And if there's something wrong with their spirit, they will have a church problem. They'll be confused as to whether they're a Buddhist or go to temple, or they're a rabbi or church, temple, religious problems. If they have a religious problem, that's a spiritual issue, okay? And that is what I think the general public sees as Orthodox practitioners, and a lot of people see of it that way. Here's the thing. You see this middle one? I guess the one we're dealing with? That carries the most amount of shame, societal shame, and family shame, and a lot of times people don't want to admit it. And so what you're going to find is a lot of people from this area will either try to self-treat, okay, or they would rather go to an acupuncturist for their mental health issues than an Orthodox or a mental health practitioner. And so this is another reason why I think it's so important for AACC members and practitioners to remember to look at this area and to learn about it. Okay, the holistic or alternative philosophy that is preached by most of the leaders in the alternative camp is like this, and I'm going to just go real quick. Something's wrong with your body. There's something wrong with your medical. There's something wrong with your psychiatric. There's something wrong with your spiritual, okay? Something's wrong with your mind, and something's going to be wrong medically, physically. There's something wrong psychiatric, and something wrong spiritually. Something's wrong with your spirit. You're going to have medical problems. You're going to have psychiatric problems. You're going to have spiritual problems, and vice versa. So it's all interconnected, and on your sheet, you can see the different charts written out. And that is one of the reasons why it's so attractive, I think. The general public sees that, and it is true. We as human beings are not robots or machines. We are interconnected. We're not categorized, compartmentalized, and there's a great attraction for alternative medicine and also the new age leaders and movements of teachers. Okay, and we're going to try to go over some of these teachers. Okay, some of the alternative modalities. The first one is acupuncture, acupressure, and qigong. I mentioned those together because they are based in the Chinese medical system. Acupressure, by the way, is the same as acupuncture, except you use your fingertips. You don't use needles to poke your skin. And it works actually in many cases better. This is an example of acupressure, everyday use in Europe. Okay, who's seen this before? Anybody? No idea. Okay. These are little bracelets. They look like sweatbands on your wrist. And you see, and here's a piece of plastic that will push down on a point. So if you put it on your wrist, this is a point right here. It's used to control nausea when you're like on a cruise ship on your vacation. Or if you're in an airplane and you're getting air sickness. You wear these around your wrists and it can calm you down. And it works just as good as Dramamine, except no side effects of drowsiness. These are used widely in Europe. They're harder to find here in this country, but this is an applied use of acupressure. And Qigong, for those who aren't familiar with it, is just a Chinese method of breathing, techniques of breathing also to increase the flow of energy. Now, the acupuncture theory is along the lines of the meridians. As you can see on this model, there are little lines that go up and down this body of the human model. And some of these correspond with gross anatomy, or they correspond with the physiological anatomy in Orthodox medicine, and some do not. But the theory behind acupuncture is if there's an bioenergetic imbalance, then the person will be sick. And so in order to rebalance these points, then we would put needles or fingertip or burn certain places on the skin in order to regulate this flow. Okay? How did this come about? Well, China has thousands and thousands of years of history, and when Chinese soldiers went to war, they'd come back with a blow to their head and it would heal, and then they'd notice, hey, after my head blow healed, I went to war with gonorrhea or painful urination, and then I don't urinate painfully anymore. So all the military officials and physicians would record all of this over many thousands of years, and they came up with this blueprint, okay, of this, where the points lie. And the thing is that another reason why it's only topical along the outside is because in ancient Chinese culture, it was not kosher, if you will. Why it's only topical along the outside is because in ancient Chinese culture, it was not kosher, if you will, to cut the body open for healing purposes. That's just the philosophy behind it. So everything lies along the top of the skin. Okay, and that's acupuncture, acupressure. And once again, this has had the most research data to support it. Studies repeated in Korea, Japan, and United States, major universities in the U.S. Human subjects have been injected with subdermally with a radioactive isotope and then mapped. These isotopes actually glowed, and you could see the lines as mapped on these acupuncture dolls found thousands and thousands of years ago. And that's one of the reasons why some of the medical schools are starting to teach acupuncture. And my younger brother, who wants to be in private practice after his residency, says, I'm going to get certified in acupuncture when I get out, just to stay competitive. And that's what it's like out there now. Sure.
When you say it maps it out, where is it injected?
Oh, the radioactive is a subdermal, under the skin, just under the skin, right? From what I have read, and I haven't conducted the study, so I don't want to speak any more about it. The question is, where was the radioactive isotope injected? And it was, from what I understand, it was subdermally and under the skin. So, okay. The next modality would be chiropractic. And how many has heard of that? Everybody, okay. In the United States, chiropractic doctors are the third largest group of licensed doctors. And the only two greater are the orthodox medical doctors and dentists, okay? And chiropractic medicine started in 1895 by a magnetic healer by the name of D.D. Palmer. And what happened was that year, it was around Kansas in the Midwest, D.D. Palmer cured a deaf man. This man was a janitor that worked, I guess, in a grocery store setting, but he was deaf, and so he manipulated the cervical vertebrae around the neck area, and this is all alleged. There are different versions of this story, and this man was able to hear. From this incident, he came to conclude that the majority of all illnesses in human beings was because of a misalignment of the vertebral column, and in the chiropractic community, a technical term known as subluxation. Who's heard of that word? Okay, good. So maybe you've been to a chiropractor. So vertebral subluxation is the cause of a majority of diseases, okay? And so his son went on, D.D. Palmer's son went on to build a big chiropractic school, and as a result, it grew, and licensure in different states was every state, as far as I know, it's almost every state in this country. What's interesting is 1970, the American Medical Association declared that it was unethical to refer any patients to chiropractor because it was dangerous. Okay, and there had been some cases of deaths, in chiropractic, and so what happened was the chiropractic community sued the American Medical Association and won, big time, got lots of money and all that, and so in the 1980s, the American Medical Association reestablished ties with the chiropractic community, and now if you go to your MD or your DO and you ask for a referral to a chiropractor, they'll be happy to do it. Okay. Herbal, naturopathic, homeopathic medicine. Now, naturopathic and homeopathic herbs in this country are not regulated by the Food and Drug Administration. And this is an important point I think that you should know for your patients and your counselees, is because it's not regulated in our country, anybody can get access to these herbs. Okay? Some people are better knowledged and have researched more, some have not. Okay? But the problem is, you might have a patient and you're working with them or a counselee and you're like, why is this guy not changing? Why is this lady not changing? And it could be that they're taking some form of herb or natural herbal remedy while they're on a prescription medication of another kind. Okay? And the problem is, you can go to your supermarket today, and right next to vitamin C, you can get kava. Kava is one of these things, and kava is designed for relaxation and all that, but some people don't know that long period usage of a kava over a long period of time consistently, and sometimes overusage can cause the skin discoloration and other problems. But these things are not mapped out, they're not regulated in this country, so that is a caveat to your patients, if you know. And sometimes they won't tell you. They're not going to tell you that they're on something, okay? And for example, his is a good in the mental health field. A lot of times, let's say you're treating a patient with depression, okay? And they are being prescribed fluoxetine 20 milligrams a day, the general Prozac, okay? And so then they won't tell you this, but they're going to say, I don't want to be on a chemical. So they may go and get St. John's wort at the supermarket and take that too at the same time, okay? We're not telling you. And you know what happens who knows what happens when you do that? St. John's wort and Prozac. Okay, you get something called a serotonin overload, okay? Too much serotonin in the brain. Because just because it's an all-natural herb doesn't mean it's not strong. And just because you don't need a prescription and you can get it at your grocery store doesn't mean it's not strong. So just beware of those type of things, especially if you're treating a depression patient. It's out there, and you can't avoid it. Now, real quick about homeopathic, and I know some of you here might know this, and if you do, just say stop. But there's a difference between naturopathic and homeopathic. This is called spirulina. It's blue-green algae. You can buy it everywhere. It's good for your health. This I would classify more as a naturopathic remedy, and this is from Nature Sunshine. I'm not trying to sell anything. My wife saw me set up earlier and said, they're going to think you're trying to sell them stuff. And I was like, no, I'm not going to sell anything. But this is naturopathic, okay? Here, these three things, you see a cream. Oops, don't these look like prescription grade? These are homeopathic medications. Now, homeopathy is the opposite in philosophy from allopathic medicine. Now, allopathic medicine, as you know, is orthodox medicine. MDs, DOs, the real doctors. Okay, so a lot of people say they're the real doctors. And so, allopathic medicine is allo meaning against, pathy meaning disease, okay? So the philosophy behind that, you have a disease subject, a disease patient. You want to do everything you can using external methods to change this disease condition to a healthy condition by external means, okay? That's allopathy. Homeopathy is the use of these, and these don't look like herbs, do they? They're not. This is homeopathic herbal medication, and this is not regulated by the FDA. Anybody can get it. You can try to self-treat, okay? And that's what I'm talking about. It's kind of a hard question, and that's a political thing of regulation or no regulation, because there are people out there who know what they're doing on their own. They don't need to go to a practitioner, okay? And then there's others that don't. An homeopathic practitioner, let's say a person has a headache. The regular doctor gives them, take 2 aspirins and call me in the morning. The aspirin chemical will actually change the brain physiologies to the state of not having a headache, okay? This is called calming. This is for headaches, all right? And a homeopathic medication actually will cause the person to have more of a headache, okay? And why? It's supposed to stimulate the resource to fight back. Okay. So, they are different. Naturopathic medications you can take for general health, like blue-green algae. This is good food supplement, okay? But if you are not full of anxiety, you're not having anxiety symptoms, and you take calming, you'll get real anxious, okay? But if you are anxious and you take this, it's going to make you a little more anxious, and hopefully your body's going to fight back and correct the situation. This is called Trameal. It's for when you get a scratch. So the difference between this cream and a cream that you get like an allopathic medication, like your antibiotic cream that you get at the grocery store, is this cream is going to cause the cut in your hand or wherever to get more infected. It causes infection in order to force the body to fight back, okay? That's a very important thing to remember between the homeopathic and the allopathic difference. Okay, music therapy would be the next alternative medical modality. Music therapy is also, like acupuncture, now accepted in the Orthodox medical community. There are music therapists. One woman in my Sunday school class used to be a music therapist at a hospital. She knows everything like a doctor does because she works in that setting. And it's very good for post-surgical rehab. And another reason why is because there have been studies done on music therapy showing that it works. One, I think, pretty neat study has been repeated frequently, started by a graduate student in Berkeley. And she put plants in 4 different rooms. One room was a control, so nothing, just water, and took care of the plants. The first room, she played country music. The second room, she played Bach and Baroque music. And the third room, she played rock and roll, heavy metal, popular music, young rock and roll, that kind of stuff. Well, this study repeatedly over and over again showed that the room that played the rock and roll, heavy metal music, the plants all died. The room that had the Bach, Baroque, classical music, they flourished and grew better than the control. And the country and Western music stayed about the same as the control. I'm not making any comments or statements about musical taste, but this is just I thought it was interesting studies. And studies like this have been done a lot, okay? The next modality, I'm not going to go into much. It's psychotherapy, hypnosis, neuro-linguistic programming, Christian counseling, okay? That's what we do. And so I'm not going to touch much about it, but it is considered a modality of alternative medicine. Real quick, who knows what NLP is? By raise of hands. Okay. Well, neuro-linguistic programming is, last time I checked with the state of Florida, is classified under the larger heading of hypnosis. But it's a technique by Bandler and Grindler that's very new. It uses auditory, kinesthetic, visual factors in modifying behaviors. It works very good in brief therapy or like in the military or corporate setting or athletic settings to change behavior quickly. As far as I know, there's no long-term studies done on long-term effects of this sort of a modality. Okay, I haven't seen anything on that, and that maybe because it's a new technique. Who's heard of Tony Robbins? Raise of hands. Wow, that's very few. Tony Robbins is a success guru, and he has these late-night infomercials. You can buy his cassettes and stuff. And he is an NLP practitioner. Okay, all of his work is based on neuro-linguistic programming. The next group would be, next modality would be shamanistic, kahuna, Native American, African, and now this is the thing, is for those who are listening to this, I don't mean disrespect in any manner, but I'm going to classify therapeutic touch and Reiki in with this group of shamanistic modalities, okay? I mean no disrespect, but so far from what I have read, I think they're faith-based modalities. And I'm sure people will put, some secular groups may put Christian counseling in with this group, okay? I put Christian counseling in the other because I believe the Bible can be proven scientifically, and with archaeology, everything we've ever done has proven the biblical record. It is not a fairy tale. It's not folk or whatever. But shamanistic will include like Hawaiian kahuna medicine. This is an example. This little guy, I'm going to use him as an example later for the New Age, kind of the definition. His name is Laki Menehune. And if you go to Hawaii, you can buy him for a souvenir at the drugstore. And basically it says, I, Laki Menehune, in one night can do wondrous things for you. Make a wish, hold me tight, rub my opu, which means belly in Hawaiian. Shine it bright, and whatever, whether you be he or she, good fortune is yours. If you own me, okay. So if you can look closely, this is definitely a syncretic idol, okay? Meaning he has the little pointy ears like a leprechaun. Now, a menehune, real quick, is a little elf that comes out and does all your work at night in Hawaii, okay, when you go to bed. And so all the farming is done by the menehunes. They're little elves like leprechauns, okay? But he's got the little pointy ears, but then he also has a long ponytail, and then he's got a big belly and is shaped like a Buddha figure, you know? So that's an example of syncretism, which later on we're going to just say New Age movement. It's syncretic, mixture of a lot of different things. Now, the last thing I want to mention, and I'm running out of time, so I got to rush. Seemingly magical alternative allopathic medical modalities. In the Orthodox medical camp, we have stuff that is incredibly magical. Dr. Francis Collins, he's a Christian doctor. Who's heard of him? Human Genome Project. We have over 90% of the human DNA mapped right now. And in the next 15 to 20 years, we will have gene-based therapies for diabetes, for heart problems, cancer, things that can be corrected on the genetic level. That to me is magical, just like all the other shamanistic type things. And he is a believer. He's a member of the Christian Medical Association. He's spoken there. I've heard his interviews and such. Nanotechnology is another area. And who's heard of nanotechnology? Anybody here? And so, and the reason I bring it up is so you know. If you have a client or a patient that's talking about this alternative medical stuff and they're very anti-Orthodox medicine, you may get that kind of, because that's happening. There's a lot of people, Orthodox medicine is stupid, it doesn't work. And my assertion is they have to work, complement each other, okay? That has to be complemented. You can't have one or the other. But nanotechnology is little tiny sub-molecular size robots that you inject in a patient that's smart. They can identify bad cells from good cells and destroy the bad cells only. Okay, isn't that neat? So that would throw the regular chemotherapy out, because with chemotherapy right now, it kills some of the good cells. Now, these are designed little tiny robots, and we're doing this now. I mean, there's testing done on animal subjects and things like that. And then another one I want to bring up is cybernetics. I have one patient right now who has lost her hearing, and she's doing a cochlear implant. And you watch the Terminator, like Cyborg, it's coming. It's an implant that will allow her to hear. Okay, and this is a technology with the cybernetic research. There's a lot of growth of neurons over transistors, just crossing them. Okay, all right. Here's some alternative medicine people, pioneers, and teachers. And once again, in light of the 1 Timothy verse, I want to encourage everybody to look into these guys and not say, well, he's a New Ager, I don't want to read any of this stuff. I would encourage you to read in light with a biblical mind frame, okay? The first one, I think he's probably, who's heard of Deepak Chopra? Oh, wow, almost everybody. He is probably the most famous one. A little bit of background information about him is he got his medical degree in India. He came to this country and practiced medicine, became a very successful medical doctor in the Orthodox camp, but ended up not being satisfied with that, returned to India and did some more research of his home culture and all of that, and came back and became a best-selling author. He is everywhere. He has his own website, so you can log onto his website and have him deliver a newsletter email to you free. Doesn't cost anything. You see what he's up to. He advocates Ayurvedic medicine. And what that is a system of medicine that, and Deepak, if you're listening to this, I don't mean to simplify this, but it's sort of like you identify what type of a person is. And I'm sure most of you heard of the ectomorph, mesomorph, and endomorph, right? So you kind of identify what kind of person that person is, and with that identification of the type, sort of like when you do Myers-Briggs or whatever, you will be able to know how that person should eat nutritionally, how they should do their lifestyle. Okay, that's Ayurvedic medicine, and there's also herbal complements to that. He does have a very strong Hindu influence in his philosophy and in his books. Larry Dossey, MD, he is the editor of Alternative Therapies Journal, and it is a peer-reviewed journal in the area of alternative medicine. He is the author of Prayer is Good Medicine. I have had a correspondence relationship with him on the internet. He seems like a very kind and nice man. His background is from Texas, and we both went to University of Texas, so we had that in common, hook 'em horns, that kind of stuff. And he comes from a background of fundamentalist Christian background. But right now, his spiritual path is not, as far as I know, in that same spiritual belief system. And one thing I wanted to note is interesting is I think this is very attractive to the general public is in his books he writes about Era 1, Era 2, and Era 3 medicine. And on page 4 of your handout, you'll see I have a description of that in your notes for you. And what Dr. Dossey describes as Era 1 is considered physical medicine, meaning something is wrong with your body, so you fix the body, and therefore you're okay. Now, what's interesting is it doesn't just include allopathic orthodox medicine. It includes acupuncture. It includes herbal medicine. It includes a lot of things, but as long as you are dealing physically with the patient or the subject, then it's Era 1 medicine. Okay? So basically, in Era 1, you are what you eat. Okay? He believes that we have moved from an Era 1 medicine to an Era 2 medicine in our time. And Era 2 medicine is mind-body medicine, what we do as mental health practitioners, psychotherapy, counseling, neuro-linguistic programming, hypnosis, imagery, biofeedback. You are what you think. The practitioner, of course, in Era 1, Era 2 needs to be in the same place at the same time as the subject or the patient or the counselee or the client. Now, Era 3 is called non-local medicine, according to Dr. Dossey, and it occurs outside the confines of time and space. And he uses a lot of quantum physics type of new research to back up this belief. And a modality of Era 3 medicine would be prayer. When you pray for somebody in Antarctica, you're here in Florida, they get better. That's Era 3 medicine. And some of the New Age practices of seances, of dealing with the dead spirits of your ancestors, of unresolved issues, past life regression therapy you may have heard about in hypnosis, that would be Era 3 medicine because you're dealing with a person that's dead. They're spirits from a long time ago. And so the healer does not need to be in the same time or the same place of the patient. Now, obviously, this is something very, very appealing to the general public. And I think people are intrigued by this because there is a definite spiritual it's spiritual. The third era is spiritual. And what Dr. Dossey is saying is that he believes our global community is moving into an Era 3 era of medicine. Okay? And I'm not going to any more comment about that. The next person would be, let's see. Oh, Russell Targ. He is a physicist and author, co-author of Miracles of Mind. I recommend you look that book up at the public library, flip through it. On one of the last pages of your, I think in the next to last page of your handout, is an excerpt from his book. So hopefully I'm not going to send this tape or nobody sends it to Russell Targ. I'm sure he won't mind. But he talks about remote viewing. He was involved with remote viewing, which is, until recently was a classified, the CIA of our country started it. It's called Project Stargate. I myself have had experience with this personally, but it's an espionage thing where people or remote viewers can be given coordinates of a certain location on the planet, and without means of any kind of high-tech machines or anything, they can visualize and maybe even hear, experience that location and draw it out on paper. Okay, it was something that was done a lot, especially before the fall, before the Soviet Union became Russia, during the Cold War, because there was a lot of this kind of inner space research in the Soviets. So our country did a lot of this, and it was all top secret. Part of it is large portions of our country would not be happy if they knew their tax dollars were going to support this kind of research. But he does talk about that in that. Now the DoD, the Department of Defense, has officially canceled this thing, so officially this is not going on anymore. His daughter, Elizabeth Targ, MD, she's a psychiatrist. I've actually went to some of her lectures, and I've met her. His daughter is a psychiatrist, and Dr. Elizabeth Targ is one of the people doing a lot of research in alternative medicine, era 3 medicine. One study she has, and if any of you are interested, I can get copies later, just call me, of the study. She has a sample of HIV-positive AIDS homosexual men, okay, that are in the latter stages. And she has them agree to be a part of a study, and at random, half of them were picked to be prayed for, and the other half were picked not to be prayed for as a control group. And it's a repeatable study. Every time the prayed for group had a higher T-cell count and lower mortality rate. Okay, so she has been doing studies in that area. She's another person. I don't think she has published any popular books, as far as I know. I could be mistaken, because it's been about a year since I've actually talked to her in person. Edgar Mitchell, Doctor of Science. He's also Captain Edgar Mitchell of the United States Navy. He is one of the original Apollo astronauts, one of the first Americans on the moon, a hero. I have spoken to him briefly. He's a brilliant man. He is the founder of IONS, or IONS. It's the Institute of Noetic Sciences. The reason I bring this up is because this Institute of Noetic Sciences has a lot of alternative medicine research, which similar to like what Dr. Elizabeth Targ would be doing. It also is a great, I don't want to use the word breeding ground, but a lot of people of the New Age community gather at IONS conferences. And I actually have been to one IONS conference. But he is the founder of it. And the story behind that is the moment he landed on the moon, and he was standing on the moon looking at our home planet Earth, he tried to explain that he had an experience that was above and beyond anything that he has ever learned as a scientist or could be materially explained. So he wanted to study the supernatural, paranormal activities. Okay, so that's Dr. Edgar Mitchell. Andrew Weil, MD, Dr. Weil, who heard of him? He's pretty popular. I think he's got a beard, and his face is usually on the cover of the books. Has a great smile. He's a Harvard-trained physician. He supports naturopathy, and he has a lot of stuff on breathing properly, too. Dolores Krieger, Ph.D. RN. She's a registered nurse and a professor of nursing. She is a co-founder of Therapeutic Touch, and that is similar to Reiki, which is an energetic modality, meaning you don't touch the patient or the subject, but you would. Who wants to demonstrate? Okay. Okay. Therapeutic touch. Let's say he's standing just like this. That would be so that healer would be trying to focus energies into the healee. So a lot of times, and she. Thank you. There you go. So. Okay, great. Yeah, and by the way, it works very well if it's an acute symptom that occurs immediately, but long-term chronic problems, like if you've had a backache for years and years, it doesn't work that well for acupressure. So anyway, with that, she came into finding this therapeutic touch type of a thing when she would see patients that are suffering and they're so badly wounded and they could not be touched. And so she had compassion and wanted them to heal, and so she and the co-founder, I believe it's Dora Kunz, decided, this non-contact, loving, healing, directing this kind of a healing force into the patient. And they have done a couple of studies that have shown it as to be effective. But it's so hard to explain energetic anatomy, even now, as somebody who studies it. There's there's some things that run true, in the different modalities, but there's also differences. So we don't know because we can't see and feel and taste. And then there's theological implications as a believer. So it's not an easy area. to deal with. So, but that's Dolores Krieger. David Morehouse, a Ph.D., he's used to be a captain in the United States Army, and he has a book out, if you ever are curious. It's his personal account of his experience with Project Scan 8. Okay? He came out and wrote about it. I wouldn't, but he did. And the name of the book, it's in your notes, it's Psychic Warrior Inside CIA's Stargate Program. It talks about that. And you can get that at the public library with your library card. And you see how all of these writings are in the library? And if you go to the public library nowadays, there's going to be more representation from more of these authors than, let's say, Dobson or, yeah. So, anyway. So, okay, the next thing is, we'll move on. What is the New Age? I have printed on your worksheet a definition of New Age by J. Gordon Menton, first edition. And I'm not going to even read it for lack of time, because we're going over. But the main point I want to say is, in my opinion, Laki Menehune here, my little friend, might be a good example of the New Age movement. Why? Because he's syncretic. He's a combination of different parts of different things. Laki's got a big belly like the Buddha. He also has a lei around his neck, which is Hawaiian. Then he's got the pointy ears from the elf, the Menehune, which is folk religion. And people believe that if you rub his belly, you can get healthy, you can get lucky, or whatever. You see how it's taken from many different, very syncretic, eclectic, syncretic, okay? So, other factors. Everybody knows what polytheism is, right? Okay, that's a factor in the New Age movement. How about humanism? We all know what that is. Relativism, emotionalism. Now, all of these factors, including syncretism, in my opinion, that is a New Age community. And the interesting thing here is Melton here does say it's a blend of two different religious ideas, one which is chiefly Christian and the other chiefly pagan. All right? So, and the point I want to make is this. Number one, and I'm not saying this in stone that I am definitely asserting this, but it's some food for thought, and hopefully to stimulate thought and discussion and to think about it. One, everyone in the overall community, including those who are in the church, evangelical Christian community, are by default a member of the New Age community unless there is a conscious, philosophical, theological, spiritual effort to not be in it. All right? Basically, it's out there. It's going to get you. And I don't mean to be like they're going to come get you, but it's out there, and you got to be careful. And also, there's a definition of what is New Age. About 10 years ago, on an interdenominational missionary project, I observed something very interesting. I just sat there and watched this. 3 Christian brothers, okay, all missionaries, all from different mainline denominations. And I'm not talking about Unity Church, like where a lot of the New Age community will go. We're talking about mainline, like Baptist, Presbyterian, Church of God, okay, mainline denominations. Let's say Joe, John, and Jack, okay, Jack is the third guy. Joe was talking to Jack. Jack says, Joe, you're starting to sound, okay, let's say guy 1, guy 2, guy 3, okay. Guy 1, guy 2, guy 3. Guy 2 is saying to guy 1, you're starting to sound like a person that goes to Guy 3's New Age church. He called a Christian brother a New Ager. And it wasn't a joke. He meant it. And guy number 3, Christian number 3, is a member of a mainline denomination. Okay? Obviously, as far as I was concerned, I saw this as an example of maybe 2 Christian brothers of different theological persuasions. One maybe more liberal or more conservative than the other. But you see, they call each other that. Last year, I had a woman call me. Hello? Yes. Dr. Liu? Yes. I was wondering if I could come over to your office and present to you, see if you'd like to purchase advertising with our magazine. We're a Christian magazine, and we only advertise for Christian doctors, Christian practitioners, and businesses. I said, well, I really don't advertise right now. It's primarily word of mouth, but if you'd like to come by, sure. Drop off some of your magazines. So she came here, very nice lady, all prepared with her portfolio to show me the different package plans for advertisement. She found out that